Welcome to the Avaaz podcast. Can you believe it? It's our 6th season. I'm Roop, the moderator, and I'm here with Dr. Madhu and Dr. Nav, who are the hosts and the medical doctors. Avaaz is a podcast we created to talk to South Asian women about health issues and get them the wellness information from medical doctors. As South Asian doctors, Dr. Nab and Dr. Madhu have the experience and the education to provide accurate information on topics that affect our community and our health. So, Dr. Madhu, she was a founding member of the South Asian COVID Task Force, now the Community Health Task Force, and has done much media around the immunization programs. Dr. Nab is an emergency room physician with also over 25 years of experience, and she was also a founding member of the South Asian COVID Task Force. I'm Roop. I work in communications, and I am the moderator, and I'm pleased to be able to bring professionals like Dr. Nav and Dr. Madhu here to join us. Joining us today is Dr. Dimithra Hippola. She is a physician for over 25 years in obstetrics. She is a physician at BC Women's Hospital. She works at Family Practice, Maternity Service, and Willow Clinic and UBC Family Practice, and she also teaches medical students about obstetrics. She is a parent of 2, and she is our expert for today, and we're happy to invite her to today's podcast on prenatal care.
I'm so glad we're talking about prenatal care today, especially in the South Asian community. So thank you very much, Dr. Dimithra, for joining us and providing your expertise. So why don't we just delve right in, and maybe you could tell us why you think this is such an important topic for us to discuss today.
Well, prenatal care is really important because it's important to keep both mom and baby healthy in pregnancy. It helps capture potential health problems that they might have and reduces pregnancy and birth complications. It also is important to look at nutrition in pregnancy, the harmful substances that mom might be consuming. And then we do a number of prenatal visits to capture that. So we usually sort of see mom every 4 weeks in the first, until 28 weeks. And then at 28 weeks, it's every 2 weeks. And the last month, it's every week. And then after the baby comes, we have a number of visits, usually 1 week, 2 weeks, 1 month, and 6 weeks for the baby before we get them back to their family doctor. And it just helps with closing gaps in care for marginalized patients. A lot of South Asians are newcomers to the country, or they can be refugees, and they have very specific health problems that we sometimes have to deal with. It's important that we address all these issues in pregnancy to keep mom and baby both healthy.
Yeah, absolutely. Yeah. So are there, I was just thinking to myself, I'm long beyond that era of reproductive age for myself, but if a woman wanted to come in and get pregnant and was thinking, I want to be as healthy as possible before I get pregnant, what are the different things that she might be able to do even before the time of conception?
So it's really important that they take folic acid. That's I think probably the most important thing. So folic acid, we usually recommend 0.4 to 1 milligrams a day. Okay. And that can be found in a prenatal vitamin. The most common one in Canada is Materna. And it's easy to take. It's just 1 tablet a day. I would recommend taking that at least 3 months prior to getting pregnant and then continue into the pregnancy. The other thing that sometimes we can clear up prior to getting pregnant is some routine blood work. So we usually will check like rubella status, varicella status, and if somebody were not immune to those things, then we would get those vaccines updated. You can't get pregnant 3 months after you get those vaccines, so they would have to be on birth control. Sometimes we'll do a pap test. So general women's health, kind of well woman kind of stuff, I think is really important. Mm-hmm. Looking at the thyroid prior to pregnancy is really important. Sometimes a thyroid imbalance can prevent getting pregnant. And looking at things like iron, B12, I think is really important to the South Asian population, a lot of vegetarians. So I would say that's really important to do.
The 2 things I'm going to pipe in that I see, because my practice is predominantly South Asian, and I do prenatal care, not obviously exclusively as you do. Pap tests, those should be up to date. And if they're not, they can be updated at the prenatal visit. And also just if you are at risk for diabetes, just if you need to be screened, that might be important. Would you agree?
Yes.
Yeah.
100%. Yeah.
So that everything you said is perfect.
Yeah. And I would say like screening for diabetes is important depending on something called the body mass index. So your height and weight, looking at that prior, making sure that mom and baby or mom is as good a health, like as good as she can be in terms of her health prior to being pregnant. The other thing that a lot of people don't know about is something called thalassemia. So a lot of South Asians are at risk. We screen all South Asians for thalassemia, which is when the red blood cells are actually smaller than normal. And it looks like you're almost anemic, but you're not. It's actually this other problem called thalassemia. And if dad's thalassemic, it can affect the baby.
That's right. 'Cause that's a genetic.
That's a genetic
cause of
abnormality.
that
Yeah.
anemia. That's right. Okay, so that's great. So all those things are important to get even before the time of conception. So I think that's important for our listeners to know that they can take care of their health even before they get pregnant to give their baby the best chance. Now, what happens? You were mentioning about getting your rubella and varicella status up to date. What happens if you're not immune, say, to a rubella, which is German measles, or to varicella, which is chickenpox, and then you get an infection during pregnancy?
Yeah, so that can cause congenital rubella syndrome or congenital varicella, which would be devastating.
Yeah.
So it can cause cataracts. The congenital rubella can cause cataracts, deafness, an enlarged spleen, heart defects, sometimes fetal death. Congenital varicella also can cause low birth weight, weakness, eye and brain problems, scarring. So those can be devastating problems for the baby.
So
And for a parent, a new parent trying to parent that child.
exactly.
And it's preventable, so it's so easy. And I actually had just read the SOGC guidelines, which are our Canadian body. I thought it was 3 months, and correct me if I'm wrong. They're saying now it's 1 month. So if you're not vaccinated, you cannot be pregnant for this vaccine. But once you get the vaccine, they say wait 1 month.
Mm-hmm.
I'm not sure if that's important. And I thought it was 3 months as well.
I thought it was 3 months, but that might be something I need to
Yeah,
look.
no, I just learned this because a patient came to me last week.
Yeah.
And she said, no, I was told it was 1 month. I go, you know what? Let me look that up. So I was preparing for this talk or our podcast. I did look it up, and the SOGC guidelines now are 1 month.
1 month.
Yeah. So I think for our listeners, the important thing here is that I know rubella is not that common, but we do have people now that are not getting vaccinated with the MMR vaccine, and rubella is one of the things that is covered by that vaccine. So there is a chance we might be seeing more rubella in the population in general, which would mean that women who are pregnant are becoming more exposed to it during pregnancy, and also chickenpox. So if you haven't been vaccinated against chickenpox, or if you haven't had chickenpox illness in childhood, you are at risk of developing these severe congenital defects in your baby if you get exposed during pregnancy. So it's really important to make sure that you are up to date with your vaccinations beforehand.
And what I find with a lot of the South Asian population is a lot of people don't know their vaccine status. They don't know if they had the proper childhood vaccines or if they were done at all. So it is important. There's no problem. You can do a quick blood test to find out if you are immune or not, if you're wondering.
And if you're not, and you're pregnant, then you get the vaccine right after we give it in the hospital.
Yeah.
Okay.
So you get the rubella booster like immediately after birth, or the varicella immediately after birth. And it's a live vaccine, so you can't give it in pregnancy, but you can give it immediately after.
Yeah.
So then we just update. Yeah.
And along those lines, I've heard about other infections you want to try and avoid during pregnancy. And one of them is the thing where you're cleaning out your cat litter box, and you shouldn't be doing that when you're pregnant. So maybe tell us a little bit about that.
That's called toxoplasmosis. And it's, yes, cat litter. So you shouldn't clean out kitty litter, but you should also not eat raw meat. So we're talking like beef tartare.
Yeah.
Is
Which
sushi
is-
okay?
I mean, it's probably relatively okay. We tell people it's probably okay. There's a whole group of, a whole subset of Japanese women who have eaten sushi for years, right? No problem. I think there's the odd parasite that maybe could transmit through sushi, but I think it's probably okay.
Okay.
Yeah, so that I think the bigger one is probably toxoplasmosis, and then there's another parasite called listeria, and that can be found in like you might hear about in the news sometimes when there's outbreak.
Yeah. Yeah, like a
so
salad bag.
salad
Yeah,
bag,
remember that.
luncheon meat.
Yeah.
that sort of thing.
Right.
And so you have to avoid, like, it's probably best to be aware of what's going on in terms of that news.
So
Because
the
there's
series
recalls.
also bad.
Yeah.
So the
Yeah.
series also
Yeah.
bad during pregnancy.
Yeah.
Okay. Great. And then what about herpes simplex virus or basically herpes?
So herpes type 2 is what we worry. Herpes in general in the vaginal area, the STD type herpes is what we worry about. And people usually know they have that by outbreaks in before pregnancy or during. And if you have an outbreak 1 month prior to delivery, it's an automatic C-section. So you need to let your doctor know that you have it. And if you have it, we put you on an antiviral medication called Voltrex a month prior to reduce that risk. And hopefully there will be no outbreak. If there's recurrent outbreaks or an outbreak in the last month, you need to let your doctor know. And then it usually means an automatic C-section.
Yeah, very important because you don't want to pass that on to the baby during the birthing
Yeah, a lot
process.
of other health.
Yeah.
Congenital herpes is also nasty.
Yeah.
Wow. Okay, yeah, so lots of good information in terms of how to make sure that you don't get infected with the wrong types of bugs and parasites during pregnancy.
That's true.
So, all right, so now we know how to be at your healthiest best before you get pregnant. We know what infections we want to avoid while we are pregnant. So, what's the next step? Let's just say a woman comes into her primary care provider's office and says, I'm pregnant. What do we do now?
Well, I'm going to start, then you can correct
Yeah.
me because you're the expert. When they come in, I first say congratulations, but I also want to know, is this a planned pregnancy? Is this something they want, right? So that's really important to establish. Once I've established that, say congratulations. Now, what do I want to establish first is the due date. When is this baby due? Way back when I went to medical school, it was always your last normal menstrual period, and then you would calculate it from then. Now, that's great, important to know, but it's very essential to get a dating ultrasound. So you need to figure out the due date based on a dating ultrasound. Just recently, that's been changed to 11 to 13 weeks here in Canada. And so we do establish that. And once that's established, and even before, we do a bunch of blood work, which I'm going to pass over to you now.
Yes, sometimes when people aren't sure, like when they're bleeding or what have you, we'll do something called a beta HCG, which actually will rise in the first 12 weeks of pregnancy. And you can track that, it'll double every 2 days. So we'll do that test along with an ultrasound to see if the pregnancy is viable. On top of that, at 13 weeks, we'll do something called a nuchal translucency ultrasound, which is part of the genetic screening. And it's usually done just like between 13 and 14 weeks. You have to do it before 14 in a very specific ultrasound places. And it helps look for, it's sort of a measurement from the nape of the baby's neck that looks at congenital abnormalities and helps form part of the SIPS test or the IPS test. Actually, it's the IPS test, which is a genetic screen that's offered in BC.
So this is for all women that are pregnant. They get both this ultrasound and this blood work?
The nuchal translucency is if you're over 30.
Over 35.
Yeah.
Okay.
The dating ultrasound's for everybody.
Okay.
Yeah.
And when is that done? What?
11 to 13 weeks is what they're saying now. Yeah.
Got it.
Yeah.
Okay.
They're more accurate then.
All right. And then what other basic blood work? Because I know I always talk about prenatal blood work. So what does that include?
I mean, you'll do a complete blood count. You look at their iron, B12, thyroid, screening for thalassemia, which is what we call hemoglobin electrophoresis, looking at their immunity levels that we talked about, rubella, varicella, measles, mumps, whatever, HIV, sexually transmitted infections like chlamydia and gonorrhea, which can be checked through the urine. What am I missing? Syphilis, yeah.
Thyroid.
Hepatitis, I did thyroid, hepatitis.
Hepatitis B and C, and then a pap test.
Yeah.
Okay. And then the pap test is done, I guess, to look for abnormal cells. But is that when they also do the group B strep test, or is that something?
No, group B strep is at 36 weeks, and that looks for group B strep, which is 30% of women have group B strep. It's a normal bacterial in the vagina. When the baby gets exposed to that, when it comes through the birth canal, it can cause neonatal sepsis or meningitis or pneumonia, mostly sepsis. And that is when they get a blood infection in babies. It's critical that we know that because it can also have not good, devastating consequences of the baby if not treated. So then if the mom screens positive for group B strep, then we'll put the mom on antibiotics in labor to protect the baby.
Yeah.
Got it.
And
Okay.
it works
That's
really well. It's easy.
okay.
Yeah.
Yes, it's very easy.
Perfect. All right. And then you'd mentioned that some of this blood work that we're mentioning today is specifically for South Asians. Like, for example, we're checking their iron, their B12, their thalassemia. So not all women need that, but there are certain categories, certain, women that have certain backgrounds that would need that more often.
Yes, and for the pap smear, like a lot of South Asian women have a hard time doing pap smears because they've never had one.
Mm-hmm.
We can do it after the pregnancy, if that's what they wish.
Yes. I see that a lot, actually. Thanks for bringing that up, because there's a fear that if you do a vaginal exam or something, what if something happens? If there's any bleeding, it's very stressful for them.
Right.
So I absolutely agree with you. So very often, just to manage anxiety, I'll just say it's okay. We'll do the pap test after.
Yes, and after, there's 2 types of PAPs now. You can do it with a liquid medium, which requires a speculum, but there's also the self-screening PAP, which is you can actually get that mailed to your home.
Yeah. We talked
And
about that.
we talked. Very easy to do.
Yeah,
So it's
great.
important that we update all women on their pap smears because this is women's health.
Yeah.
Right?
Yeah.
Exactly. All right. So now you're pregnant, you've gone to your primary care provider, you've gotten your prenatal blood work. What's next? Let's talk about some of the other things that probably we don't talk about, which are diet and exercise in pregnancy.
Very relevant to South Asians. So go ahead, because I know you're dying to talk about that.
Okay. So I think the biggest thing with South Asian diet is that it's loaded with carb. And
That's true.
whether it's Punjabi women, Sri Lankan women, Vietnamese women, Chinese women, there's a lot of carb in all these diets. So I have a lot of Filipino patients and they eat a lot of rice. It's rice 3 times a day. Fried rice for breakfast, rice for lunch, rice for dinner, and with very little of something else with it.
Yeah.
In Sri Lankan diet, it's a lot of roti in the morning with some sort of like sambal. And then there's Sri Lankan sweets, like we have this one called kaludodol and kyaung, which is it's full of sugar. In Punjabi culture, it's pinni and pinjiri.
No, that's after the birth.
Okay, yeah.
Before the birth, there's lots of
It's a lot of
roti.
roti. Yeah.
But I'll tell you, okay, now I have to plug in the gourd thing here. So it's the cha. So I had someone come in who obviously did not watch our previous podcast, and I said, she goes, I don't put sugar in my tea anymore. I go, that is so good. I'm so proud of you. I just put gourd. And I go, no, this is seriously last week. I go, no, gourd is sugar. What?
Oh my God.
So no gourd, no rusk, no bronte, like minimize it.
Yes. And in pregnancy, you only get an extra 300 calories a day. It's not a lot. It's either like a sort of a small meal.
Yeah, we
or
can't
2
eat,
small snacks a day, and it should be healthy. You're not eating for 2.
And you also don't need to gain a lot of weight in the first trimester. So some women are so stressed, I haven't gained any weight. I go, that is so good. You don't want to.
It's actually normal.
Yes, it's normal.
Right? So we want to see weight gain in the 2nd and 3rd trimesters. And it really is dependent on what body weight you start at, too. We don't want everybody to gain 20 to 30 pounds in pregnancy.
No, some shouldn't.
Yeah.
There's also not kuli shoti or open season on eating whatever you want, whenever you want.
No. I was having my Haagen-Dazs ice cream or whatever it was back in the day, and that was not a good. I shouldn't have. So I did gain more weight than I should have, and I attribute that to the ice cream.
Yeah.
Yeah.
So not good. And I you're right. It gave me like, oh, I'm pregnant. I'll just have some. I'm craving an ice cream. No, that's not going to work.
There's something called the healthy plate. It's a resource that we use in pregnancy and otherwise. And it's like half the plate is green leafy vegetables and a bit of fruit. A quarter is protein the size of a deck of cards. And then a quarter is carb, which is like, but I always tell people go with like the low glycemic index carb.
Yeah.
So like sweet potatoes, oatmeal, quinoa, brown rice, right?
Mm-hmm.
And then you still need 2 to 3 servings of dairy in a day, right? So there's no other time to eat healthier than in pregnancy.
Yeah.
And also, don't use a pregnancy that you have to sit down now, you can't move. Exercise, walk. So do things that will help you have an easier delivery. Because if you're just sitting, it does make your muscles, your core muscles, your pelvic muscles weaker. I'm not saying go run a marathon, but if you have been exercising, continue exercising. If you're confused about the exercise you're doing, ask your primary care provider. But
Yes.
exercise is probably really even more important.
And the other thing you can do is get in a pool.
Yeah.
It's really refreshing in the summertime when you're pregnant. It's hot outside and muggy, depending on where you live in Canada. Is get in the pool, water walk, do some laps.
Yeah.
Takes the weight off your joints.
Yeah.
Prenatal yoga is really healthy. Prenatal Pilates, like all of those are fine
There's
to do.
so many things out there.
Yeah.
Yeah. And also, when you have so much weight, it creates so many more risk factors
Yes.
for what can go wrong in a pregnancy to the mom. And just briefly, we should also talk no cannabis, no smoking, no alcohol.
Exactly.
And caffeine. Let's talk about how much caffeine is allowable. I think I did look that up because I'm not a huge caffeine drinker, so I had to look that one up. According to Health Canada, they're saying 300 milligrams of caffeine per day. So that would be 2 cups of drip coffee and about 3 cups of tea a day. So I usually tell my patients 1 to 2 cups of caffeine per day. That's it. And yes, no gourd.
Okay. Good to know.
Yeah.
Good to know.
And green tea also has caffeine.
It does.
Right? Although if
And
you're
thing is,
so
It's Coke and Diet Coke.
Yeah.
Coke,
Diet Coke,
chocolate.
Yeah.
Yeah.
But Coke really should be avoided. Like
In general.
in
Yeah.
pregnancy, it's just liquid sugar.
Yeah.
Liquid sugar. Yeah.
Exactly.
Yeah, I agree.
So we've talked about diet and exercise in pregnancy. And from what I understand, gestational diabetes is a huge issue, especially in South Asians. So maybe we can talk a little bit more about that.
Yeah, gestational diabetes, again, because of the diet that's heavy, high in carb, South Asians are at high risk for this. And the sugars run high in pregnancy. And there's a test that's done between 24 and 28 weeks to look for it. It's called the GTT. It's a 1-hour glucose test. You get a sugar drink, and then an hour later, we test your blood sugar. And if you fail that, then you go on and have a 2-hour diabetes test. And then if you fail that, then you go to the diabetes clinic, see a dietitian, see a doctor sometimes. And some women end up on insulin.
Okay. And is that done? That test is done on all women who are pregnant?
Yes.
Okay.
Pretty much.
And so that's gestational diabetes. Dr. Madhu, anything else that you wanted to add on that?
Just that if you do get gestational diabetes, it usually is managed through diet, but it also increases your chances of diabetes later on by 1/3, like 33%.
Right.
So
I think we talked about
yeah,
our diabetes
yeah.
episode one time as
Yeah.
well.
So we have a genetic predisposition plus a diet predisposition.
Right. So especially important for women.
And it causes complications in the babies that are born. Like some people think that it's good to have big babies. No, when you have big babies, you have complications from diabetes in the mom and the baby. It's not a
And
good
sometimes
situation.
that baby's too big to come through the pelvis.
Deliver.
So more of those women end up with C-sections. We want to try to encourage vaginal birth because the healing time is much less with a vaginal birth.
That's
You'll walk
better
out
for
of the
the
hospital
baby.
better
Yeah.
for the baby.
Yeah.
Better for the baby.
All very important points.
Yeah.
Okay. And then what about preeclampsia? Maybe you could tell our listeners about what that is.
So preeclampsia is when women get high blood pressure in pregnancy. And eclampsia is when they actually have a seizure, which is a complication of that. So you end up with high blood pressure, protein in the urine. They get symptoms of headache, swelling in the hands, feet, and face, sometimes visual symptoms, and it can damage your organs. Like you see it in the blood tests. So you see it in, there'll be a high protein coming through your urine. And the risk to mom is that there's a high risk of seizures. And also they can develop HELLP syndrome, which is a really severe case of preeclampsia, where they get elevated liver tests, protein in the urine, they get low platelets, and that's scary when it happens.
Yeah.
It's almost an automatic C-section sometimes, and ends up we have to give them medications to prevent a seizure sometimes.
But how do we know if a woman has that? It sounds like it doesn't come with symptoms. So how do we know?
Well, some women have high blood pressure to start off with, so they have chronic essential hypertension, which is also high in the South Asian population, especially Filipinos, Punjabi women sometimes. I see it in Sri Lankan women. So there's sort of a propensity for that. So they have low grade hypertension, and then we end up doing home blood pressures throughout the pregnancy when that's the case. The risk to mom with this is that they can get a stroke sometimes in the worst case scenario, liver, kidney failure, the HELP syndrome that I talked about, and then the baby can affect the baby's growth. So you can have a small birth weight, small gestational age baby, or a failure to thrive baby. It can result in preterm birth, abruption, sometimes a stillbirth in the worst case scenario, hypoxic episodes for baby, which results in learning deficiencies and that sort of a thing.
So I think the important takeaway from that is get regular checkups. And if the doctor is, your primary care provider is sensing that, hey, the blood pressure is running high, there's treatment for it.
Right.
So it's just best to have regular checkups. And that's the whole purpose of this podcast, is to make you aware.
And we do put people on medications to control their blood pressure in pregnancy. The goal is to get to 37 weeks and beyond if we can. And some women sometimes end up needing to be hospitalized for their blood pressure as well. So that it's an important thing to watch out for.
Yeah. So diabetes, high blood pressure, both very important to be monitored during pregnancy. Okay, great. I'm just going to bring it back around to genetic testing for our final question, because I know we haven't delved into that yet. But I think, again, in the South Asian population, it's an important topic. So maybe you could talk to me about why we do genetic testing in pregnancy.
Well, genetic testing is offered to everybody, much like the diabetes tests. There's a blood test that's done in early pregnancy. So everybody's offered either SIPS or NIPS, which is a blood test that's done between like sort of 9 and 14 weeks. And the second part's done between 14 and 21 weeks. Second part's best done early. And then we pair that with something called a nuchal translucency if you're over 35, which is that special ultrasound done before 14 weeks. The other thing that we can offer people is they can self-pay for something called an NIPT, which is 99.5% specific. It's a better test, not covered in the province of BC, but it's covered in other provinces. And it screens very well for things like Down syndrome, trisomy 18 and 13, neural tube defects, which is when the neural tube doesn't close properly. So the space between the spinal cord and the brain.
Yeah. Okay.
Yeah.
So what you're saying is we don't need to do. Back in my day, they did amniocentesis and CVS.
They're less. I don't see them as much anymore at all, because now there's
better tests that are more
invasive. Yeah,
that's great. Wonderful.
So let's just summarize and get back to the whole pregnancy journey. So what we've gone from this is regular checkups.
Yeah.
And you've gone over the frequency, and that's fine.
And at those checkups, we do a blood pressure, a weight.
Yeah.
We measure the size of the uterus and listen to the baby.
To check the growth. And any concerns and so on. And we've talked about the dating ultrasound. We've talked about gestational diabetes between 24 to 28 weeks. The detailed ultrasound, when is that done? When we can really see the baby's anatomy?
That happens at 20 weeks.
Okay.
And sometimes we'll do another ultrasound in the third trimester if we have other things that we need to look at in terms of growth. If there's preeclampsia, gestational diabetes, we automatically need to get one at 32 weeks sometimes.
So I know this is a lot of information for our audience to absorb. So that's why regular checkups are so important, because there's certain tests that need to be done at certain times during the pregnancy journey, from ultrasounds to genetic testing to blood work to testing for diabetes. And the really important stuff is looking at high blood pressure. What's your weight gain like? How's the baby growing? So even though it doesn't seem like much is happening, there's a lot happening. And primary care and OB is here to help you to just navigate this path that's really exciting. One last thing. If your blood group type is negative, which we didn't talk about that, at 28 weeks, you will get something called a RhoGAM injection, and that's to protect the baby with antibodies and so on. But again, there's a lot of information, so you need to get your regular checkups.
And if you're pregnant now and you haven't had this done already, don't fear. There's always catch-up procedures to have you caught up so that you can be as healthy as possible. So I want to thank both of you for the information that you've given us today. I think this is really critical information that's needed both before pregnancy, during pregnancy, and beyond to keep both mom and baby as healthy as possible. So thank you again, Dr. Dimithra, for your expertise on today's topic. We really appreciate you coming in today and helping us out with us. Thank you.
Really exciting.
Any final thoughts, Dr. Dimithra, to pass to the viewers that you are passionate about?
I just wanted to talk about 2 really good websites.
Okay.
One is the Pregnancy Vancouver website,
Okay.
which is a really good way to find a maternity provider if you live in Vancouver. That's developed by the Divisions of Family Practice in Vancouver. It's a good website. It navigates people through the stages of pregnancy. And the other thing is the Smart Parent or Smart Mom app, which women can go on. And it provides women that are pregnant with a text message weekly. What questions to ask your care provider in pregnancy.
It's great.
And different developmental stages. So lots of good information there.
Mm-hmm. Great. Good to know. And we'll put that in our resource section in our caption.
And do you have any thoughts?
No, I've learned a lot. As a woman, like I said, past her reproductive era now, and good 20 years out from this part of my life, it's good to get this information for myself as well. I don't do this for my day-to-day work, and so I've learned a lot. So
I have one final thought.
Yeah.
Banjiri or beneath, you don't need them postpartum. To keep the culture and traditions alive, you can have 1 teaspoon with unsugared chai. But you are not working in fields. You are not doing manual labor. We do not need that high density stuff, especially postpartum when we're trying to get fit again. That's all.
Never a time to eat actually healthy, right?
Yeah.
Follow the healthy plate.
Yes. There you go.
With
Thank
1
you, Dr.
teaspoon of Banjiri.
Yes.
Thanks again. And thank you to our listeners.
Thanks for listening to the Avaaz podcast. Your support means a lot to us. We are a volunteer-run nonprofit, and we are South Asian women who believe that we should have access to accurate medical information. So thank you for listening. Please do share the podcasts and the episodes with your loved ones and with people in our community and outside of our community. We hope you'll follow us and watch on YouTube, follow us on social media, and also you can find us on Spotify and Apple Music. Please tune in again next time. Thanks for listening. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.